Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist, and today I'm going to be taking you through two simple muscle strengthening techniques and a myofascial release technique to help conquer hip bursitis and hip pain. So if you're somebody who does have hip bursitis, or maybe you have IT band syndrome, or you have stiffness in your hips, or you're just someone who wants to maintain good hip mobility and hip strength, this video is for you. So let's get started. The only thing you're going to need today will be an exercise strap. You can use a yoga strap. If you don't have one of those, you can just get a belt from a robe. All right, so we're going to start with lying down on our back. We're going to work on these obliques in our tummy. Knees are bent. Feet are about hip width apart, maybe a little further apart, but certainly not together. And your arms are up, pointing to the ceiling. Wrist is right over my shoulder. And we're going to start by lowering the opposite arm and leg. And you just straighten out your leg, lower your arm, and then tighten your tummy. Tighten, 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 tighten as you bring them back to their starting position. There's one. Let's do 9 more for this first set. Pull, tighten, tighten, tighten your tummy. Very good. Number 3. It helps to imagine you have a pair of pants on that has a zipper on it, and then every time you lift your leg and your arm up, tighten, pull that zipper up, close. All right, here's number 5. You're unzipping, and now zip it back up, tighten, tighten, tighten. Very good. Unzip the zipper with control and tighten it up again. All right, there goes number 6, just finished. Here we are on 7. You're doing good. Tighten that back up. Great. 2 more for this first set. And last one. I'm sorry, this is number 9. Here's your last one. All right, we're just going to take a break, 2 deep breaths. And back again for set number 2. Here we go. Lower, so unzip that zipper. Come back up, zip that up tight. So what I'm doing when we take that small break between sets of 10, it's about a 5-second break. And the easiest way to kind of count a 5-second break is 2 deep breaths. So if you want to count 5, you can do that. But the 2 deep breaths is what that other way to count it can be done. All right, here we just finished number 4. Here's 5. Tighten, bring that zipper closed, bring it up. Very nice, and very slowly lower it. Tighten that zipper, pull it up. Good, zipped up your pants, unzip them again. Here's number 7. Just finishing that. Here we go on count number 8 of the second set. You're doing good. So we're strengthening these abdominals because they're so important in giving the hips balance and strength. And as they become weaker, this is number 10, as they become weaker in our society, we lose that balance in our pelvis. All right, 2 deep breaths. Ready? Here's our last set on this side, then we're going to go to the other side. Unzip the zipper, come back up. So when muscles weaken through our lifetime just because of our postures, poor postures over long periods of time, sitting for a long period of time, these abs get weaker. And when they become weak, they lose their ability to give support to the pelvis, to the hips. And so what we want to do is re-strengthen where the hips have lost their support. And this is one of those groups of muscles. Just finished number 6. Here we go with number 7. Zip that up, hold it tight down there. Really make sure that lower abdomen is working for you. Sorry, coming back up. You just finished number 8, 2 more. And last one, come back up. You're going to take a 5-second break. And we're going to go to the opposite sides. Ready? Here we go. Don't ask me why I lowered that arm. I've trained it. It's that neuromuscular training. I just finished with 3 sets of 10 for that other side to go. Here we go. So we're on number 3 right now. Here's number 4. You might find that you're stronger on one side than at the other. You might find it's easier one side than the other. Also, if you're feeling really, really tired, or you can only do a set or one set, that's fine. Everybody's body's different. So we're all starting at different periods or different positions. All right, here's number 8. I sure want to move that other arm for some reason. Here's number 9. Zip, zip up. Unzip. On number 10, zip up, zip, 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 zip. And short break, 5 seconds, 2 breaths. Back up again. Here we go. Same side. Lower, unzip. Tighten, tighten, tighten. That's what you're concentrating on. We want to return strength to these obliques, these muscles that are so important in giving us pelvic stability when we walk, when we stand. When these get weak, the hips have to take over, and you get all kinds of overuse problems like hip bursitis, stiff hips, IT band syndrome. Just finishing number 5, 5 more. Number 6, here's 7. You guys are doing great. You're doing great. That's number 8, 2 more. And number 10, we're going to do that 5-second break again. All right, last set. Here we go. Unzip the zipper. Zip it up tight. Put your focus back in your lower abdominals right now. That's where you're focusing. Holding that tight. Slowly elongating those muscles as you lower. Tighten them and contract them back up as you zip up. Very good. So important to keep re-strengthening the areas of our bodies that go unaddressed for years. And we don't know it until we have those symptoms of things like hip bursitis or weakness or instability in our hips or IT band syndrome, that we haven't been using the right muscles. Here's number 9 finished. Last one until we start hurting. And then we have to go back in and take care of it. Very good. Okay, you can remain seated. We're going to remain lying down. We're going to work on the glutes. If you want to put a pillow under your head, that's fine. It won't change the effectiveness of the muscle, so feel free. If you've got any kind of neck pain, please do use a flat pillow. All right, so here we go on the glutes. You're going to lift up. I'm going to just show you this once. Lower one hip down, lower the other hip down, and then come back down. And we're going to call that 1 repetition. All right, here we go. Lift your hips to straight line, slow lower one side, and slow lower other side, and come all the way down. There we go. That was 2. Here's number 3. We're going to lower one side, bring it up, lower the opposite side of the floor, bring it up, and then lower both hips. Short break, right back up. Probably already feel this if you haven't used your glutes in a while. Lower your other side and come back down. If you have low back pain, but when you're lowering one side and the other, just lower both together at the same time. You'll still be effective. All right, here we go on number 6. One hip down touches the ground. The other side lowers, and then both lower. Lift up. Here's number 7. Got each side. Slow lower down. Here's number 8. And when you're coming up, you're making a straight line from your knees, hips, and shoulders. Come back down. All right, 2 more for this first set. And roll back down. Last one. Touch, and then touch. Slow lower. Very good. 5 seconds or 2 breaths. You can feel your heartbeat starting to raise on these. All right, let's go again. Make sure your feet are at least hip wide or wider than hip width apart, so that you have good balance there. If you've got your feet too close, it's going to be a lot of work for the low back to do in this technique. So we want to really keep it all gluteal work. All right, here's our second of our second set. We're going to do 3 sets. you're starting to fatigue and you really can't get up far, or you feel like you're using your back, that's enough. Sorry, I did an extra one there. All right, here's number 4. Lower one side, lower the other. So make sure you're always comfortable when you're working out, when you're doing therapeutic exercises like we're doing now. If another part of your body starts becoming painful, you need to stop. It's your body's way of saying, that's all I can do for now. Tomorrow, let's add on another repetition. All right, we just finished 6. Here's number 7. One side, alternate to the other, slow lower. Back up, touch the hip down. Really, you're touching your buttock down. Other side, and then lower. Here's number 9. Lower one side, back up. Lower the other side, back up. Slow lower. And here's number 10. Lower the left, or your right. Lower the opposite side. Come down for those 2 deep breaths. Here we go, last set. Hips are up. So you always want to take a little break between sets of 10, because you have to reoxygenate muscles. It's the oxygen that helps to make create the contraction. And I hope I said we have to reoxygenate the area with good blood flow. 4, opposite side, back up and lower. Here comes number 5, all the way up, straight line, lower one cheek, lower the opposite cheek, slow lower. Here's number 6. You're doing good. If you need to take a break, no shame in that. Do it. Take care of your body. Don't overdo. That's when people fall behind. They do too much the first time or second time out. All right, here's number 8. Slow lower, 2 more. Number 9, lower, come back up, and then slow lower together. And number 10, up together, lower one side and up, lower the opposite side and up, and come back down. Very good. Okay, you want to grab those straps. We're getting ready to go into the myofascial release technique. I just want you to be able to see what my foot is doing. It's better for you to see this way. So I'm going to put my strap. If you don't have holes in your exercise strap, just put the strap around your foot and cross it. It helps to hold that on easier onto your middle of your foot. I've got my leg turned out. If you can't turn your leg out because you have hip pain on the other side, then put a big pillow underneath that to relax your leg on. You'll still be effective. And all you're going to do, so the strap is, and in this case, the wall is holding my foot up. I'm just using my arms in the strap to help direct the foot across my body until I get to a point where I feel a nice stretch on the outside of that leg and up into the back of the hip and the side of the hip. Some of you will only feel it here. Some of you will feel it here. That's fine, as long as you're feeling it somewhere through the side of your leg and the side of your hip. When you get to that point, that's where you're going to hold it. You're welcome to use a wall to support your leg if you have a heavy leg or weak shoulders. Don't worry about that. But for the rest of you, we're going to be doing this just lying down. All right, y'all got a good shot of that. Okay, so here we go. We're going to be here for 5 minutes. I'm just going to put my legs straight. When I was against the wall, I had to bend it to get it out of the way. And the other leg is not far up off the floor. It's about 1.5 feet maybe. For some of you, you can go lower as you come across. The way you know you're at the right height is because you can feel it through here. For some of you, you're going to have to be higher. For most of us, we're going to be lower. The higher you are, you will get the hamstring too. So we've got that timer going. We're going to do 5 minutes. And my leg is completely relaxed. All the work is coming from the strap and my arms. Now, if you notice, I don't have my arms up here. I'm not like this. You can do that, but if you want to really conserve your energy, get your elbows down and elbows bent. And that uses the least amount of energy from your shoulders and your arms. And like I said, if your leg is too heavy, even in this position, then go ahead and turn, face the wall, lie down, and put your heel up against the wall. And let the wall hold the weight of your leg. So we're doing a myofascial release technique right now. Myo means muscle, and fascia is the connective tissue in our body. So we have this big sinewy cobweb in our body called fascia, or connective tissue. And it runs from the top of the head to the bottom of the feet, side to side, front to back. So it's a three-dimensional web. Well, this fascia surrounds, it supports, and it infuses every structure in our body. So it infuses and surrounds and supports all our muscles. And by the way, that's what myofascial, myo is the muscle. So it surrounds and supports, infuses muscles, tendons, ligaments, your organs, your eyeballs, blood vessels, nerves, bones, everything has fascia through and around it. Well, what we now know recently being the last 40 to 50 years in medical science and research, is that fascia also responds to injury, just like your bones and your muscles and joints and tendons can respond to injury. And when fascia is injured, it binds down and tightens and dehydrates, and it can put up to 2,000 pounds of force per square inch where it's been bound down and dehydrated. And that can be from overuse, can be from repetitive use, injuries, trauma, somebody falls off a horse, stress, being a human being alive on this planet, all those things, and poor postures for long periods of time cause fascia to become tightened and dehydrated, and pulling the tissue, whatever structure, it pulls that down into a tightened position too. So you end up with pain, because muscles are pain-sensitive tissues, so is our blood vessels and our nerves. So you get pain, and then you have a loss of mobility. So when I was working with my patients, I found that once I started introducing the fascia techniques for them, they got so much better, not faster, but they got better, and then they had permanency to the positive changes. They weren't coming back every 3 or 6 months because their symptoms came back. They were having long-term relief, and then they had their home program. They knew how to work on themselves. I showed them exercises, myofascial techniques, so they could continue working on themselves if they needed to keep that pain relieved or some stiffness, relieved. So that's why we're doing this. When we can release the fascia through the side of the hip, it helps the hip to move back to its natural position. It opens up the hip, mobility comes back, joint mobility improves, balance improves, just everything gets better. And then there's permanency. So when you're doing these techniques at home and you're doing this video, do it for 14 days in a row, just so you can really get some serious change in the problems in your hips, the stiffness, the mobility issues, the pain. And then after 14 days, then you can back off to maybe once or twice a week of doing this video. And that'll help maintain those positive changes so you can keep enjoying your lifestyle, pain-free lifestyle. Okay, we're in that last minute. What you're feeling for is a release, a myofascial release. So it feels like butter melting, something stretching, less pain, that's a sign. Or you might feel like, you're all of a sudden, oh my gosh, my leg just went across my other leg even further. So that's a sign you got some lengthening in there. That's great. You might have some increase in pain through the side of your leg. And that's only because as you're elongating and stretching, you might have a little pressure through over the bursitis. And so you can back off a little bit if you want. But as long as you're relaxed and you're breathing naturally, you're not doing too much. If you're over here and you're tensing because of pain, or you're not breathing and you're tensing your breath, that's too much and you do need to back off. That's your criteria. All right, we're coming up to the end of our 5 minutes. Feel free to go longer. You'll just get more releases, no problem. All right, thank you so much for joining me today, taking care of yourselves, and I look forward to seeing you in our next video.